Except for COVID, I believe my mom would still be here with us.
Jeannie Davis knows her mom was vulnerable. At 86, the pastor's wife, eternal hostess, and best, hardest working mom ever, was in a nursing home and a wheelchair with some dementia and lung issues. On Election Day, Beverly Hammond slipped away to rejoin her husband. She'd been diagnosed with COVID-19 less than 2 weeks before.
And it cost her her life.
As of today, the state says the virus has cost nearly 8,000 lives in Michigan. Based on data published last month, heart disease is still the #1 killer, followed last month by cancer, COVID-19, COPD, and stroke. However, COVID is gaining fast. In fact, since that data was published, the University of Michigan said the virus has now pulled ahead of cancer.
From March till present, the second leading cause of death in Michigan was COVID-19, second only to heart disease.
To U of M epidemiologist Joseph Eisenberg, COVID's second leading death cause position makes clear the severity of the crisis. And then there are the excess deaths.
So if we look at mortality rates this year during the COVID pandemic compared to prior years, there's significantly more deaths happening this year.
Here's how much more. So far in 2020, overall deaths are 13% higher than the expected number based on prior years, a percentage that is sure to spike higher. In mid-April, at the pandemic's spring peak, there were 74% more deaths overall than would have been expected. The smallest increase since COVID hit came in mid-June, when total deaths in Michigan were just 3% higher than prior years.
It's a huge public health problem.
Death records show COVID has killed 4 times as many people as the flu this year. So far this year, 1,500 people have died from flu and pneumonia. That's not far off from prior years. There were 1,600 total in 2019 compared to 1,800 or so the 2 years prior. U of M's Eisenberg said, while you should still get your flu shot, it is more important than ever right now that you protect yourself too from the much deadlier COVID-19.
I would say that this is a concerning time that we're entering into this winter. We need to be vigilant in adhering to the public health guidelines that we know work.
It's no joke.
Jeannie Davis hopes her loss will prompt others to be more careful because even though her mom had other conditions, Davis knows it was COVID that robbed her of whatever precious time she had left.
And she had so much family to still live for.
At the end, Davis made sure her mom heard the voices of family, even if only through a web camera.
We were always telling her what an amazing mom she was, how blessed we were that she was our mom. She had done so many amazing things in her life and how thankful we were for the way that she raised us.